Hello everyone, good evening. Again, we are going to resume our named classification. Today we are going to see E to L. Okay, so the first one is Eckhart score. It is very important in case of post-treatment score for achalasia cardia. Usually, once you treat the achalasia cardia, again you calculate a score called Eckhart score. Based on that score, there will be total score of 12. If there is a score of more than 3, it means that whatever treatment that you have given, it is failure. Okay. Then second one is Gleason score. It is a very important one. This is for prostate cancer. We will see subsequently. Then next one is Haller index. It is for pectus excavatum. You know that there are two conditions, pectus excavatum and pectus carinatum. So Haller index is for pectus excavatum. It's a radiological assessment. How we will calculate and all we will see shortly. Then it's a new entity. Input classification is for bladder pain syndrome, which is also called interstitial cystitis. Then it's an old classification for penile cancer. It goes by the name Jackson staging. Okay, right. Then next one is very important. It is your modified Johnson classification. It is for benign gastric ulcers, right? Next one is Lauren or Ming classification. We have seen this classification in the last session of named classification. This is for cancer stomach. All right. Next, the last one is, just remember the name, Lugano classification. It is for gastrointestinal lymphoma. The classification per se is more important for postgraduates. So we will see shortly. Right. Coming to the first one. So this is Eckhart score. This is for post-treatment score for achalasia cardia. Just remember the components which are present here. So one is weight loss. Then second one is difficulty in swallowing, nothing but your dysphagia. Then third one is retrosternal pain. Then regurgitation. So normally in achalasia cardia, there will be the classical symptoms will be something like drop. So dysphagia, R for regurgitation, W for weight loss. So once you treat achalasia cardia, all these symptoms should come down. If there is something like uh, still the persistence of symptoms or there is aggravation of symptoms, it means that whatever the treatment that you have given for achalasia cardia, it is failure. Okay, so whenever you have got a Eckhart score more than 3, it means that treatment is failure. Okay, just remember this much, right? So D for dysphagia, R for regurgitation or retrosternal pain, and W for weight loss. So you can remember the components of this Eckhart score using the same mnemonic. So D for dysphagia, R for retrosternal pain and regurgitation, then W for weight loss in kgs. All right, then next one. Again, it is very important for both the PG entrance examination and also for the postgraduates. Then there are three glissons we need to remember. One is glisson's grade or pattern. It is nothing but you know that prostate cancer we will take biopsy either transrectally or transperineally. Once you take that sample and send it to pathologist, they will process it and they will look into the microscope how the picture is. So based on that microscopic pattern, you have got something called Gleason's grade or pattern. You have one, 2, 3, 4, 5, and just remember one is most well differentiated, and as you come down, so as the number increases, as the grade increases, you have got a worst prognosis. So grade 1 is good prognosis, or it is nothing but well differentiated, whereas grade 5 is something like a very poorly differentiated or even anaplastic. So it is nothing but your microscopic pattern. Please remember, this is based on microscopic pattern, right? Second one, let's say for example, and you know that usually whenever you take biopsy, you will take 12 samples. 12, uh, 12 times you will take the biopsy and there will be grouping which will be done. Okay. So based on that, so let's say for example, all your 12 samples has got only one. Let's say it is 3. So whenever you get only single pattern or single grade, it should be doubled to get your what is called Gleason score. Sum is nothing but you will just add. Okay. Let's say for example, out of 12 samples, you have got let's say for example, out of 12 samples, 6 has got a grade 2. Okay, grade 2. Then rest of the 6 has got, let's say for example, rest of the 6, or let's say for example, 4 of them got a grade 1, whereas other two has got a grade 4. Now, if this is the pattern, you have got different types of grades, then what you should see, you have to add most common grade. So what is the most common? 6 samples has got grade 2. So here you need to add 2 plus highest or worst grade. What do you mean by that? Is there anything other than 2 which is like more poorly differentiated? Yes, you have. Here you have grade 4. So you need to add 4. So this is the Gleason score if you have 3 different types of patterns. So here the score will be 6. Let's say for example you have got only out of 12 samples you have received, 6 has got grade 3 and other 6 has got grade 1. Now, if you have only two types of grades or two types of patterns that you are seeing, obviously you have to go for just add these three. So you just add 3 plus 1 here in this case. So that will give our Gleason's score, which is also called Gleason's sum. Okay, all right. So this you need to remember. Then group is something like very complicated for your level, so it is not required. Just remember how the grouping is done means, again it is based on total Gleason score or also the pattern, right? You see, this is the group categories. You don't require this. Just remember what is this grouping based on means. One is Gleason score. Mainly, why are you calculating Gleason score means, one is to prognosticate the patient. So one is to tell the patient whether he has got good prognosis or bad prognosis. The other one is you will require this in treatment algorithm. So based on Gleason's score, you will stratify the patients accordingly. Then based on that, it is one of the components for your treatment algorithm protocol. All right, right. Then next one, this is your Haller index. This is for pectus excavatum. So what is this condition? Pectus excavatum. So just remember, part of the chest is something like a excaved or something like that. So it is a radiological assessment. So maximum transverse diameter of the thoracic cavity by minimum anteroposterior distance. This is called your Haller index. So based on this index, you will calculate using two parameters. Maximum transverse diameter is to minimum anteroposterior distance, right? Then next one, modified Johnson classification is for benign gastric ulcer. So we need to remember, uh, let's look at the diagrammatic representation. So first one is here is present at the lesser curvature or incisura. So this is your greater curvature, this is your lesser curvature. So let's say for example you have got one ulcer at a lesser curvature. This is your type 1. This is your type 1. Let's say for example you have got a ulcer at the one is present at the body of the stomach, and you also has got a duodenal ulcer. So you have got two ulcers here. So just say for example, because you are having two, let's say it is type 2 modified Johnson classification, right? You have got one in the body of the stomach, then the other one is duodenal ulcer. Then next one is you have got ulcer. This is your somewhere here your comes your pylorus. So something like this will be your pylorus. Just in the prepyloric area you are having one ulcer, prepyloric. Okay, so if you have ulcer in the prepyloric region, that is your type 3. Next, so let's say for example, in the lesser curvature only, this is something like a at lower aspect. Whereas if you have the same ulcer on little bit at higher aspect in the lesser curvature, at lesser curvature only, but it is at a little bit higher aspect. Okay, so or let's say for example, even the ulcer could be, this is your GE junction. So you can have ulcer even at the GE junction also, right? So either of these two will constitute type 4. All right. Then type 5 is nothing but it can occur anywhere. But the main etiological factor will be there will be NSAID abuse. So it is nothing but your NSAID induced ulcer. So whenever you have got NSAID induced ulcer, that is your type 5. It can occur anywhere in the stomach. Now, what is the most important thing you need to remember here is usually this type 2 and type 3. They will occur because of the increased acid output. That is why whenever you have done endoscope, upper GI endoscope, and when you see either type 2 or type 3 ulcer, it means it is because of the increased acid output. In treatment, that is why your antacids will be prescribed mainly for this second and third type of modified Johnson classification. All right. So this is regarding benign gastric ulcer. This is regarding modified Johnson classification. Next one. Again, it is very important classification we need to remember regarding carcinoma stomach. So you have got intestinal type and the other one is diffuse type. So let's look at this table in a more simpler way. So just we will remember the table with the some specific side headings so that we can easily understand. So usually intestinal type will be there with increased age, whereas diffuse type of gastric cancer is mainly seen in younger age group. Okay, right? Then, as you can see, intestinal type is more common in males. So it is males greater than female. Whereas diffuse type is more common in case of ladies. Okay, then what type of disease is intestinal? Usually it is something like a more of a environmental etiological factor. Whereas diffuse type is more commonly seen in families. It runs in families basically. So it is more of a familial disease. Then, what are the main predisposing factors here? As you can see, whenever you have got gastric atrophy or you have got intestinal metaplasia, that means the epithelium is changed. So, what are the predisposing factors here? One is gastric atrophy. Second one is whenever you have got intestinal metaplasia. Intestinal metaplasia. These are the main predisposing factors for your intestinal type of gastric cancer. Whereas, as you can see here, blood group A. So, A blood group is more common to get diffuse type of blood can. I mean, sorry, A blood group is more common to get diffuse gastric cancer, right? Then coming to the genetics, very important. So you need to remember there will be microsatellite instability and there will be APC gene mutation. APC gene mutation will be there in case of intestinal type of gastric cancer. And there will be commonly your P53 and P56 inactivation in both intestinal type and also diffuse type. So there will be inactivation of both P53, which is your tumor suppressor gene, and the other one is P16. Both are inactivated in both types of gastric cancer, right? Then, and very important is your E cadherin. So E cadherin is something which is mutated in case of diffuse gastric cancer, which is decreased here. Now, you know what is the function of E cadherin normally? Say, let's say, for example, these are all your different cells. So, in between cells, so one cell is adhered to another cell with the help of something called this is your nothing but your E cadherin protein. E-cadherin protein. And mainly your gene is your CDH1 gene. So if this gene is good, your E-cadherin will be normal. And the sticking of one cell to another cell will be normal. So whenever you have got mutation in CDH1 gene, your E-cadherin will be decreased. So whenever E-cadherin is decreased, these cells are not sticked to each other anymore. That is why there will be cells will be seen like a row rather than in a straight line, and the characteristic pattern you see in microscopy is called your Indian ink pattern. Indian file pattern, sorry, Indian file pattern. All right. So this is the Indian file pattern. All the cells will be separated from each other because the binding protein, which is nothing but your E cadherin, is decreased here, right? Then coming to the pathological aspects. So what you see in microscopy is usually something called gland formation will be very much high in case of gland formation is very sorry. So gland formation is seen in case of intestinal type. Whereas as I told you just now, the cells will be something like a separated from one another. Also, the cytoplasm will be pushed at one side of the cell, and your nucleus will go to the periphery. This characteristic pattern is called this characteristic pattern is called signet ring pattern. Signet ring pattern. This is something that is seen in case of microscopy again, right? Then, what type of spread is commonly seen in intestinal type of gastric cancer? It is mainly blood. So it is mainly hematogenous spread, right? Whereas in case of your diffuse type, it is more of a transmural or lymphatic spread. Okay, so it will be continuous. That is why transmural or lymphatic spread, right? These are the important characteristics between intestinal type of gastric cancer and diffuse gastric cancer. So the name of the classification is Lauren classification, right? Next one. So again, the classification per se is more important for postgraduates, and for PG aspirants, you can just remember the name. Lugano classification is for gastrointestinal lymphoma. So you can remember it easily. Just remember, you have got four layers in our GI tract, right? So mucosa, submucosa, muscularis propria, then is your serosa, right? So whenever there is GA lymphoma which is confined to the GA tract, that will come under your 1. Again, this stage 1 is classified into two subtypes, 1E1, 1E2. So when do you say it is 1E1? When it is confined to, when there is involvement of mucosa or submucosa, it is your 1E1, right? Then when there is involvement of muscularis propria or plus or minus serosa, that is your 1E2. Then let's say for example, if it has not been confined to the GI tract, it has gone into the abdomen. So it has extended into the abdomen. Where again, let's say for example, if it is involving only the local nodes, that is your stage 2-1. Then if it goes to other nodes which are distantly, so when it goes to distant nodes, that is your stage 2-2. Please remember there is no stage 3. No stage 3 for Lugano classification here. Okay. Then, and there is another entity which is called 2E. What do you mean by 2E? Let's say whenever the GA lymphoma has penetrated the serosa, whenever it is involving the adjacent organs, let's say for example, when you have stomach GA lymphoma, when it has penetrated the serosa and it is involving nearby small bowel. So like that, whenever it is involving adjacent organs or the adjacent tissues, that is called your stage 2E. All right. Then whenever there is extranodal involvement, once it goes beyond the nodes, where and also whenever there is supradiaphragmatic nodes. So whenever you have got only within the abdominal cavity, that is something like less than stage 4. Whenever this disease goes above the level of diaphragm, whenever it reaches and it involves the diaphragmatic nodal involvement. Let's say for example, you have got mediastal lymph node involvement. Like that, whenever it has involved supradiaphragmatic lymph nodes also, that will come under your stage 4. Okay. So this is important for more for postgraduates. This is Lugano classification for gastrointestinal lymphoma. Thank you.